Is there any of those experience leave trauma to those
Yes,
patients?
hugely, hugely. It's part of the reason why I care so much about this work is maternal mental health is one of the most expensive global problems that we have. There's many dimensions to it. When you have a birth that is traumatic for women, there are things you can do to make it worse, and there are things you can do to make it better and less traumatic. One of those things, according to the World Health Organization, is dignity, supporting women's autonomy and agency. Don't touch them when they don't want you to. Ask for permission. It's very basic human rights things.
Sure.
And the second piece is skin to skin. So when you put a baby on a chest, and I did this for 15 years, I experimented. We would have births where things were going kind of off side, like they were not going well. And so we would say, okay, we're in the operating room, we're not gonna put the baby on the chest, it's too dangerous. But then the odd time we would. And I wanted to experiment with that because what I learned through the research and through experience is that when you put a baby on the chest, even if it's like 5 minutes, there's something about the skin touching that it re-changes the neural pathways. So the way that the mom's brain fires changes, the neural pathways change, they fire differently and they wire differently. So bonding and attachment is better. And then the traumatic experience is not the same. So the memory changes. So now her memory is different. So you buffer it. So there's a protective aspect of that. So then we would do skin to skin, and then these women who would have it in the postpartum would not experience the same level of PTSD. But when you use skin to skin, it's a huge intervention that reduces maternal mental health costs. It has so much potential to save the health system money and to reframe that postpartum experience for women and the partner.